We had discussed earlier video on newborn screening in general, and in this video I'll have a quick look about why hypothyroidism and picking up hypothyroidism is very important. So the thyroid hormone is a hormone which is produced by a gland in the neck called the thyroid gland. We have it here, and some of you may have seen people with the goiter, which is a swelling of the thyroid gland. So the thyroid hormone is very important for various body functions, and in the young baby it's very important for brain development. So a baby who is low on thyroid hormone is at high risk of developing mental retardation or low IQ. Thankfully, the thyroid hormone goes across the placenta, so even if the baby has a problem with the thyroid gland, if the mother's thyroid function is normal, the baby is not affected. And once the baby comes out, it's very important to diagnose this early, because even 2 to 3 weeks delay can lead to significant IQ drop in the baby. When we were training, we used to see babies with hypothyroidism, but now we don't see it commonly, because the most common reason for hypothyroidism is from the gland level, and that is usually picked up by an increased TSH, thyroid stimulating hormone, which is part of the newborn screening test. So almost every country now offers newborn screening, and even countries like India, where newborn screening is not well established, at least the thyroid hormone assessment is being done. Where there is a significant risk of hypothyroidism, like a family history, especially if the mother had high thyroid function at any stage, we do offer the thyroid function to the baby before discharge. But the newborn screening is offered to all babies. The newborn screening report takes 7 to 10 days according to the circumstance and your lab results turnover. However, that is adequate time to pick up, and usually it's conveyed as an emergency, and if it's an abnormal result, the doctor will call you and discuss with you regarding confirming and starting treatment early. Sometimes you have borderline results which will need further testing. Of course, delay is bad, so newborn screening should be done for all babies. The question of whether the newborn screen picks up all cases of hypothyroidism comes up. No, it doesn't pick up all cases, because we have central causes where there is a pituitary malfunction. We have hypopituitarism. The pituitary gland is a driving force, it's in the brain, and one of the hormones produced in the pituitary is the thyroid stimulating hormone. And the reason we measure the thyroid stimulating hormone rise as a marker of hypothyroidism is congenital hypothyroidism is mostly due to the gland not being formed normally, or the enzyme function is not happening normally. So when the thyroid is not producing, the brain is producing more TSH to stimulate that, and that's why we get a high TSH as a marker. But if the problem is in the pituitary gland, the high TSH will not be there. You will actually have a low TSH, so the driving force for the thyroid is missing, and that's why you get hypothyroidism. Thankfully, this is not a common problem. It's quite rare, and we have to remember, if there is a baby with prolonged jaundice, for example, even if the newborn screen is normal, you still have to do the thyroid function, including the free T4, because of this reason, that's central. And if the baby has a small penis or neonatal hypoglycemia on a persistent basis, we do consider central causes, and we have to include the full thyroid profile as part of the testing. So my message is clear: don't miss hypothyroidism in your baby at any cost. If you are the parent, always opt for the newborn screening, because picking up early and treating it will avoid significant problems, because any impact on the brain is permanent, and as you know, we are not a complete person without a fully functioning and intelligent brain. So please share this message with your friends and colleagues. Thank you.